Once again, welcome. Please mute your phones until ready to speak. Utilize the chat box to ask questions throughout the meeting. Meetings will be recorded, so if you want, I can send it to you. Here's our two places to email. If you have a question, you can go ahead and email heocchildcare@pima.gov or schoolsupport@pima.gov. Okay. Here is our vaccination information. Again, I present this every time. But now we're at 24, which is yay. We're at 70%. 24 zip codes in Pima County are at 70%. Vaccination reduces hospitalizations and deaths. COVID vaccination breakdown on this data sheet, and you can get that on our Pima County website under data. And it breaks it up all nice and easy. You can even get by school district. You can get by zip code, census tracts. Um, Here's some more information. If you're looking for a place to get vaccinated or your people are, we have plenty of sites. I looked at the sites today and there's a lot of them out there on all sides of town. So please promote. Um, you also can go to the ADHS website, which will show you pharmacies and Safeways, all the other places that are also vaccinating. The CDC has an also this a site, a vaccinefinder.gov, and you can also even text this number here, 438-824 to go ahead and with the zip code, they'll find you a place to go ahead and get vaccinated. Okay, here are the Pima County areas. Actually, this is the Arizona statistics. Right now, we're at 2 million deaths and 2,900, I mean, 200, 2 million cases and 2,900 deaths. Pima County details, we've had 11,000 new vaccination doses reported since last week. We're at 75.6% vaccinated. 20,000 new tests reported, and those are coming back at 10% positive. This is all on the state website, which I have a link on the bottom that you can go ahead and pull up. This is the comparison that I have been showing. The bottom one is last month, and the top one is this month. Well, it's as of the end of February. So it's as of 4/2. So what I like to show is this first block is our young ones under 20, and it's slowly going up, slowly, because our 5-year-olds are also getting vaccinated now, and hopefully soon the 6 month to 4 year will be able to also, but we haven't heard anything on that yet. But it's slowly going up, and you can see all the percentages that have gone up from each age level. Also, this is on the ADHS website. There's something new on the CDC website that you at childcare, as caregivers and the parents, and you can print it off. It's on the CDC website. It's called 6 Things to Know About COVID, and what this is very resourceful for your. It's a good resource for your parents. I just briefly put everything that's on it, but it's a really nice website. It explains COVID-19 vaccinations for children is safe. And people are still hesitant, but we gotta this kind of explains that they're safe, and it gives you like a definition. Another thing it says is getting vaccinated can help protect children against COVID-19. It gives you another little spurge and information and why. It gives you some information on the side effects. It talks about the doses, how they're different. Um, and then it tells children can who have already had COVID-19 should still get vaccinated. It gives you also a little bit of information on that. Children can safely receive other vaccines at the same time they receive their COVID-19 vaccine. It gives you things that parents might ask you, plus it's a good handout, and CDC lets you print it out right on their website. And the link is on the bottom there. Many ECE programs, which are you guys serve young children who may not be eligible for vaccination or are able to wear masks consistently. And you all know your kids. Layered mitigation strategies are highly recommended, including universal indoor masking for those 2 years and older. We've always recommended that. That has not changed. There is this site, I think I talked about it last meeting, but now we can see by counties where we're at. Right now, Pima County is at low. You can pull all these websites off of the CDC and they'll tell you and the expectations for low, what they feel people should do in those particular categories. I have the link for the right-hand side up here, which is by county, and it'll explain here. And then I have the link that provides this nice little chart. It'll tell you. This is a question that comes up quite a bit. Exactly when are they fully vaccinated? Well, when does it count? Age 5+ can get the Pfizer. Primary series 2 dose is 2 doses. Okay. Fully vaccinated is 2 weeks after final dose, and up to date is fully vaccinated plus booster. Ages 12 and up can get boosters. Okay. When boosted, a person, and you'll hear that term a lot, you're boosted. A person is boosted and up to date right after getting their booster dose. Here's the cheese. I like the cheese. And it goes over the mitigation strategies that we have been going through all along. From personal, this is what you should do, from shared as a group, your school's ventilation, all your mitigation that you guys have done real well at. Here's our guidance again: hand washing and respiratory, cleaning and maintaining healthy facilities. You do your own contact tracing and isolation and quarantine, and you've done very well at that too. You notify your parents. You go ahead and you guys deep clean your rooms. You've done all of that. Here is the test for indication and monitoring. Some of you are still taking temperatures. Some of you are still wearing masks for your older kids or your staff. These are these all these things help in mitigating, but these are the symptoms that you can and you guys know they're very similar to allergies and colds, and so you have to distinguish between the two. What is the right? Is it COVID? Is it colds? I know that's been a big question a lot. Reminders, always report. We're still doing that, and the website's still the same. Just go ahead and report your cases to me, and I talk to everybody who reports. Don't forget our once a month meetings. This is another slide I've added for assistance for families because many of the families you guys get sometimes are having trouble meeting pain, whatever they're having trouble with. We have a good list at Pima County, and it's on the website. We also have Arizona's Childcare Resource and Referral, which is also on here. We have DS listed on here. If you guys need PPE, if you're missing you need gloves, masks like that. If we have it, they will go ahead and you can place an order and they'll call you and tell you when it's ready for pickup. My special guest is Crystal Rombach. She's from the She's a Vaccine Preventable Disease Program Manager. And I wanted her to present to you guys because you guys also have a lot of young ones that will be starting school. Plus there's all these immunizations out there that these parents may need help in finding a place for them. But I'm gonna let Crystal take over here and present to you guys. Thank you so much. Crystal?
Thank you, Sylvia. Can you all hear me?
Yep.
Sounds good. So, yes, my name is Crystal Rambo. So, I'm the Immunization Program Manager for the Health Department. So what I wanted to get on to mostly see if I could just make sure that you all knew about was just that the program exists and what we can offer for early childhood education providers and to schools, and just kind of what sorts of resources we offer to the community. Because I think a lot of people don't even really realize that the health department does a lot of this sort of work outside of direct immunization administration. School health is definitely something that's very near and dear to me. I did 5 years of elementary school nursing before I joined the health department. That was really where I cultivated my interest in vaccines. And I know that vaccine compliance is a ton of work. But really it's the foundation of all of our immunization compliance as people reach adulthood, because we know that it's really difficult to get people immunized once they're grown up. So definitely want to thank everybody for their hard work with their immunization compliance. It's a really big job, and any way we can support that, we're certainly here for it. So this slide shows just some basic information about recommended vaccinations for younger children. This really covers from birth to age 4 to 6. One thing we always try and educate to for any kind of provider or professional that interacts with people is that there's required vaccines for school, but then there's also recommended vaccines that are recommended by the CDC. So there is some difference in those lists. So the required ones for school, um, pre-K would be your Hep B's, your DTaps, your Hibs, your IPVs, which is polio, the MMR, the chickenpox, and that's pretty much it. Hep A is required up in Maricopa County, but not down here. So the reason that I bring that up is you'll notice there's some additional vaccines on here, the PCV13, the rotavirus, the flu, and now COVID is also here on this schedule. We always like to make sure that people who work in school settings, if you have any opportunity to educate parents about the fact that there are required vaccinations, but that when you go to most places that immunize, you'll be offered additional vaccines. Any chance you have to educate parents to that is a really good opportunity, because we don't want parents to come to our clinics and think this is all I'm getting for my child because it's what school required, and then possibly they may be less interested in those additional vaccines. Sometimes if we have school staff that will tell their parents, these are the required vaccinations, but there may be additional recommendations, and we encourage you to get any recommended vaccines. That can really help us out, because it sets that stage that there are other things outside of school requirements that are really for the health and safety of our children. So I always like to point that out. On this particular table, the little yellow boxes show ranges of when the immunizations can be due. These schedules, of course, can get pretty complex, and anybody who's read through immunization records and has had to check them for compliance knows that there's a lot of strange situations that come up with immunizations, and we know that. So that's one of the things that we do offer is kind of immunization compliance checks. If you've got weird scenarios or weird situations, you can certainly always reach out to us and have a public health nurse review the record, or myself review the record to kind of help you. The state is also, the Arizona Department of Health Services is also available to kind of guide you through those situations as well. Arizona Department of Health Services has a school immunization page that has all their resources. It has all the forms that you need, all the information about the immunization data report that's due annually. I can drop that in the chat just in case anybody has not seen it. That's a really good resource for all things kind of state compliance, and a really important one for education providers. And then this slide shows our immunization clinics, the sites, the hours. I think one thing that's always important to stress about our services is we are truly walk-in services. So people can make appointments, but it is also walk-in. So I think that's really important to let schools know, because we know, and I particularly know, having worked in schools, that a lot of what schools need is kind of at that moment immunization services. Because if you have a child that's not compliant and you want to get them back in school as quickly as possible, oftentimes walk-up services are really the best way to accomplish that goal and get that child back in school. So that's one of the things that the county really is happy to offer the community and make sure that we can get those turnaround times really quick so that, because we know that kids really need to be in school. Whenever you send your families to us, we would love it if you would encourage them to bring their records. That really helps us for sure. If you have families that will be visiting, really any clinic, but especially our clinics in the summer, coming earlier in the summer is a really good idea because our wait times get very long toward the end of the summer and our waiting rooms get very crowded. So especially in times of COVID, if they can come earlier in the summer, that would really help just to alleviate some of that burden and get that, chore that most people don't really like out of the way. Other things that I'm always here to assist with, if you have questions about your immunization data reports that are due to the state in the fall, I can help with those. They've gotten a lot easier over the years, but if anybody needs support with those reports, I'm here for that. And then certainly if you have any kind of immunization related questions, I can take a crack at it. And if we cannot arrive at an answer, I have the contacts with the Arizona Department of Health Services and can get an answer usually on stuff pretty quickly, which is great. We can also do on-site education for staff or parents. We obviously haven't done as much of that in the last couple years because of the pandemic, but we are here for that if needed. And I have also worked with parents who are kind of reluctant or having trouble with vaccines, or they have questions about vaccines. You can also refer parents, and I'm happy to talk to people about that kind of stuff too. So I think that was pretty much it for me. I can put the ADHS link in the chat and put my email in the chat as well. That's really the best way to reach me. But I can also take questions and answers if anybody has anything right now.
Thank you, Crystal. Anybody who has any questions can unmute at this time. Thank you.
Sylvia, so just to clarify, are the walk-ins back to normal for vaccines? Because I know during the pandemic, I was told that I should tell the parents to call ahead and make the appointment. So it's back to walk-ins now?
That's a great question. So we do take appointments, but for the most part, our clinics are back to mostly walk-in services at this point. Yes.
Thank you.
Yeah, you're welcome.
Thank you, Crystal. I appreciate you coming and talking to us. You have valuable information that I know they can use. And if any other questions come in, we can forward them to Crystal, or we could send them to her directly at her email. She posted on the bottom of the chat. Thank you, Crystal. Does anybody have any other questions?
I do. I might have missed it at the beginning of the meeting.
Okay.
It's a COVID question. Just wondering if there's any updates to mask wearing for the 2 to 5-year-olds.
No, there is not.
Okay.
If we're looking at community levels now, and the county has not come out with anything new for ECE providers yet, it's pretty much left up to your boards and councils to decide what's best for your school. You guys know better than anybody else what your population needs. But that really is a good question. Thank you for reaching out.
Thank you. That helps.
Any other questions? Well, I thank all of you who came and attended, and I will see you all at the next meeting. Please feel free to contact us if you have any other questions, or you probably all have my phone number, but I thank you all for attending. Have a good afternoon.